I'm Dr. David Velkoff, the medical director and co-founder of the Drake Institute of Neurophysical and Behavioral Medicine. One of the most valuable, best-kept secrets of the last 40 years is our discovery that many illnesses and anxiety-related disorders can be overcome without medication. The Drake Institute utilizes medical biofeedback administered under a physician's guidance to enable patients to use their own mind-body connection interaction to heal themselves. I learned decades ago that patients don't want to become sick, but under enough stress or even mild chronic stress, your body can eventually malfunction. All of a sudden you have an illness or a stress disorder that is dominating your life. You don't feel as good. You're not sleeping as well. You have symptoms that weren't present before. You've lost a sense of confidence and security over having control of your own physical health and well-being. The Drake Institute's unique treatment program utilizing medical biofeedback enables patients to overcome many stress-related disorders and conditions such as PTSD, anxiety disorders, panic attacks, insomnia, depression, addictions, high blood pressure, migraine, tension headaches, irritable bowel syndrome, and many more without utilizing medication. Our treatment helps patients shift from a stressed, fight or flight, uncomfortable, unhealthy state into a directed, deep level of specific psychophysiologic relaxation where healing occurs. You can't achieve this with normal relaxation methods, nor from a pill. Your body just begins to shift back to more normal functioning. The patient is able to shift into a sustained feeling of calmness and well-being where your mind and body begin to regain normal, healthy functioning again. Anxiety is relieved, headaches go away, high blood pressure comes down. Even your immune system can reboot and work stronger to protect you from viruses. You sleep better. This is achieved by the patient developing the ability to self-regulate to normal psychophysiologic functioning and sustain long-lasting improvement. In terms of stress and anxiety, things are much worse today than they were even 40 years ago, and yet we have had a solution without drugs for the last 4 decades. And technological advances have enabled our treatment to be more effective today for our patients. I'm going to show you a brief archival news footage that is still relevant and remarkable today, and then a very short interview with a more recent patient that was treated with our current technology.
This is News for LA at 5.
Wilson begins the first of a 3-part special report on a new approach to controlling stress. Warren is in the newsroom now with part 1. Warren?
Tricia, that new approach to controlling stress emphasizes self-treatment for some of the most severe cases of depression. And practitioners say they are finding rapidly increasing numbers of patients suffering from stress-related diseases.
Today, machines like this one are helping doctors measure their patients' stress and teaching them how to control it. Case in point is Karen Demina. Until a few months ago, she believed her doctor who said she'd have to sleep on her side for the rest of her life because of a hernia and other depressions.
Yeah, and in my worst times when I would cry for 24 hours a day, it's very scary.
Today, she's a different person because of what she went through in a medical program of stress management.
It's probably saved my life, or, I was in such a terrible state. When I came here, I was so ridden with anxiety and depression, and it was an incredible thing. I have never experienced anything like that in my life. And coming here, I've been coming, 2.5, 3 months, and I'm a new person. I feel great.
Tonight we continue our special report on stress and how doctors are trying to help people control it. In part 2 of his series, Warren Wilson looks at a method that measures stress, and Warren is standing by in the newsroom with more details. Warren?
Tricia, there are millions of people on the unemployment roll, and doctors say they are under great stress trying to live the way they used to. But people with jobs are also affected by those without jobs. In most cases, they don't know exactly what to do except to take a lot of tranquilizers seeking peace of mind. Yesterday, we told you about a new approach to medicine treating people with stress or stress-related diseases. Today, in our second part of this special report, We focus on that program, which is called Biofeedback.
Biofeedback, it's a training process where you learn to control physical reactions in the body that we used to think we couldn't control. In most of us, these reactions are running unchecked, and they lead to unhappiness, anxiety, many diseases like headaches, hypertension, ulcers can make us more susceptible to infections. And very importantly, people just don't feel good.
These three people, strangers before coming here, are tied into the latest developments in computerized medicine. They're learning to control their stresses and in the process spending much less than ever before, even though medical costs are rising. They're able to listen to changes that are taking place while relaxing. Tone changes measure the rise and fall of stress, and the patient remembers how they feel at low-level stress tones. In just 20 minutes, after a few sessions, the patients go home and continue the treatment themselves. They say their lives have changed.
I've been off medications now for about 5 months with my hypertension well under control.
Oh, I had terrible headaches. I had them for most of the day, every day. And they were just terrible. Nothing would help. I would take the aspirins, 2, 3, it didn't matter. Nothing would help. And then I had my neck so bad. I thought that was a terrible case of arthritis that had flared up. And it wouldn't go away. Massaging, nothing worked. And now since I've been coming here, well, it wasn't long after I started coming here. They just disappeared. All of a sudden I thought, hey, where'd my headaches go to? It disappeared.
Tonight we conclude our special report on medical approaches to controlling stress. In the final part of his series, Warren Wilson sums up the approaches to controlling stress and what some companies think about the treatments. Warren is in our newsroom with more on the story. Warren?
John, the Drake Institute in Santa Monica has proven success with its use of biofeedback and associated methods of treating people with stress-related diseases. Since that type of treatment reduces the need for drug prescriptions and cuts down on medical costs, doctors say medical insurance companies are now more eager to support it. Insurance companies see it as a new tool to prevent sickness, as well as cut down
Pharmaceuticals. Many of the patients have given up taking tranquilizers.
I was on 3 Librium a day, and still I had it constantly. I mean, I would, I'm not suicidal, so I didn't go out and do it, but I had the feeling I was going to all the time. It was a terrible thing to live with.
How many do you take now?
What, Librium?
Yes.
I take nothing. I take no medication at all, and I feel great.
We live in a stressful world today. It's a nature of our modern urbanized society. Stress is part of our life today. You can't avoid stress. Well, you can learn to deal with it much more effectively and feel much better about your life. It's not just living longer. You don't just want somebody to eat better and exercise better. That's important. But if they don't enjoy their life and feel good about themselves, longevity could be a sentence.
Hi, everyone. My name is Dr. Priyanka Wali. I am a board-certified internal medicine and obesity medicine physician, and I'm very happy to speak to you today about the Drake Institute and what benefits that I personally received. A little bit of context. I have been meditating since the age of 16. So I have many, many years of experience with learning how to self-regulate. But what I learned at the Drake Institute completely took my practice to a totally different level. It was through the alpha biofeedback and the neurofeedback programs that I was essentially taught with the feedback how to self-regulate in a way that allowed me to achieve a deeper level of peace and stillness within that frankly made me a better practitioner with my patients. You see, the more self-regulated we are as healers, the deeper we can go with our patients. What I learned at the Drake Institute was unparalleled to anything I had ever done before. And this is someone who had meditated for decades. So really powerful impacts. And to say that the Drake Institute was helpful is truly an understatement, because it actually fundamentally shifted my ability to self-regulate in a way that I never even realized was possible. So I highly recommend the Drake Institute. It's very helpful. Even if you don't have any problems per se, it's a wonderful, wonderful tool to help you optimize in order to be the best person that you're here on earth for.
If you're interested in our stress treatment program, please contact us at 310-208-2020 or 949-653-2020, or visit us online at www.drakeinstitute.com. Thank you.